Welcome to the Cross Systems Training. My name is Julie Radlauer, and I'm with the Ronick Radlauer Group. Thank you all for being here. Today, we are going to learn about the child welfare system. First, we will speak with the Director of Child Protective Investigations at the Broward Sheriff's Office, and then we will speak with the CEO and President of ChildNet, which is the foster care system in Broward County. So let's get started. Here with me now is Kim Gorsuch of the Broward Sheriff's Office. Hi, Kim. Thank you for coming.
Thank you for having me.
So, what agencies make up the child welfare system?
So, Broward is a bit unique compared to other places in Florida, and we are comprised of 3 or 4 different agencies. First, under a contract with the Department of Children and Families is the Broward Sheriff's Office, who conducts child protective investigations. The second is ChildNet, a privatized local foster care agency. The third is the legal work done by the child welfare system is done by the Office of the Attorney General. And then there are related groups, Attorneys for Parents, the Guardian Ad Litem's Office, and other programs and services that the families are referred to for whatever type of service they might need.
Okay, thanks. So what is the role of BSO's Child Protective Investigations? Are they police officers?
They are not. They are more like social workers. They receive cases where an allegation of child abuse, abandonment, or neglect has occurred, and their job is to determine if in fact that did occur, and if it did, are the children safely able to remain in their home. So they are fact finders, they are assessors, they determine what problems may be occurring in the family, and then they refer to the vast number of services that we have in the community to try and address whatever the issue may be.
Okay. And if I'm working out in the field and I suspect a child is being abused or neglected or abandoned, what should I do?
So all professionals in Florida are what's called mandatory reporters. If they suspect a child is being abused or neglected or abandoned, they must report it to the Florida Child Abuse Hotline at 1-800-96-ABUSE.
Okay, and if I report a case of abuse or neglect or abandonment, should I expect to contact the investigator or be contacted by the investigator?
You should expect to be contacted by the investigator. In every case, if we know who the reporter is, you can report anonymously, but professionals generally do not because they've got good information and they are reporting in their professional capacity. Then the investigator will contact them, ask for any additional information that they may have, location of the children if they happen to know, those sorts of things.
Okay, so what's involved in a child protective investigation and how long does it take?
So under statute, the investigations take no more than 60 days. So we are in and out relatively quickly. As I indicated, we are more fact finders and service brokers. We are not long-term treatment professionals, but we are in and out relatively quickly, just determining if the abuse occurred. And our main focus is to assure that those children are safe.
Okay, so then if we look at the statistics, how often do child protective investigators actually remove children from their homes?
So we're pretty busy in Broward. We investigate between 1,100 and 1,200 cases per month. Wow. And of those, we remove probably between 80 and 100 each month. Many of those children, though, do not go directly into foster care, but they go with a relative, a grandmother, an uncle, an aunt, or a close family friend. It's better for the children all the way around. It lessens the trauma. So while technically on paper they are removed, they are placed with a loved one that they are familiar with and close to.
Okay, so then sometimes children are removed and they're living with a relative. Sometimes children are removed and they go into foster care. What happens if during an investigation a child is not removed? they get to stay with their family, but there's still some concerns. What happens then?
Right. So that happens a good portion of the time. And in those cases, we will refer to programs and services that the family may need. It may be something as simple as they need a referral for childcare, so mom can go to work, or it could be substance abuse treatment. If we have a parent who is actively engaged in substance misuse, mental health treatment, or a parenting class, or something that would enhance their ability to care for and manage their children in the home.
Okay, well, thank you very much. This has been very enlightening. So we've learned a lot about the Child Protective System, and next we're going to speak with Larry and learn a little bit about the child welfare system and the foster care system. So thank you so much for coming today.
You're welcome.
Now we're going to speak with Larry Ryan, CEO and President of ChildNet. Hi, Larry. Thank you for coming.
Thanks, Julie.
So tell us, what is ChildNet?
ChildNet is the lead agency for community-based care in Broward County and also in Palm Beach County now. What does that mean? The lead agency is the organization, nonprofit organization, essentially responsible for operating the local system of foster care and related services. We were created in 2002 specifically to do that and have been Broward's lead agency since 2002, operating the system of foster care in Broward County.
Okay, so then what is the role of a child advocate?
Okay. Child advocates are our dependency case managers. They are the ones that really have to control and manage and steer the case through the child welfare system or the foster care system. But people need to understand that they don't really provide service or any kind of clinical service or any kind of intervention. They are the ones sort of that have the oversight of each individual case of a child who has been adjudicated as dependent because of child abuse, abandonment, or neglect.
Okay, so then does a child advocate work with the family or with just the child?
We call them child advocates, and that goes back a long way to the beginnings of ChildNet. But they have to work with the entire family and the entire community. Our major concern, our focus, our mission is keeping children safe. But to do that, we need everybody working it. And so child advocates have to really work and interact with birth parents, with foster parents, with behavioral health care providers, with the schools, with the Department of Juvenile Justice, with everybody. And that's what they do. They sort of manage all those pieces.
Okay, then so how long is a child typically in the foster care system?
Well, the ideal in the state of Florida is a 12 months stay in foster care. But that can vary. Right now, the average length of stay for a child, Broward Child and out-of-home care, is about 10 or 11 months. Sometimes, though, children stay longer. It's usually because it's taking longer to get their parents where we need to get them so that the child can be reunified, or because we're going to the process of adoption, which typically takes well over 12 months. But some cases get closed sooner, and then there are also cases where the child hasn't been placed in a foster home, but they may be placed with a relative, or they may even stay with their parents under protective supervision, and those cases can usually be closed much sooner, more like 6 or 9 months.
Okay, so when a child is in the foster care system, what services or supports are available to them so that they can get their needs met?
Well, in the state of Florida, we do a pretty good job of making sure that kids in foster care get the basics. Almost every child in foster care is automatically Medicaid eligible, and so we get their medical needs taken care of, we get their behavioral health care needs taken care of, and in fact, the last few years in Florida, we have a special plan just for foster care kids in the state of Florida, operated by Sunshine Health, that really recognizes the unique needs of kids in foster care or abused, abandoned, and neglected kids.
Okay, and so what evidence-based practice programs do you guys use? Since everybody gets great care, which programs do you guys use?
Well, that's an interesting thing. So everybody gets, in foster care, like I said, they get really good basics. I think what we're trying to improve right now is to be sure they get even better. And so that gets us to things like evidence-based practices. At ChildNet, we have just begun to really focus to not only make sure they're getting evidence-based practices, but that they're getting them with fidelity, and that they are high quality, and that they are doing the things and having the outcomes they need. I don't know that anybody has really paid enough attention to that. We've been content with saying, oh, we're sending them to a provider who says they do trauma-focused or says they do child-parent psychotherapy. We are now going to make sure that they're doing those things with fidelity and that they're having a really positive impact in helping the child.
That's really exciting.
It certainly is. Yeah, we're thrilled about it, and we're at a place now where it makes sense. We have tremendous community support for doing it, and it's going to be a community effort to make sure that it happens, because ChildNet doesn't always pay for the services, so Medicaid may reimburse. But now we need to work with the providers, and we need to work with Sunshine Health to make sure that the network of providers is doing those evidence-based practices and doing them the right way.
That's great. So you mentioned, though, that in order for children to really be successful, all of the system partners need to work together. So how can system partners help child advocates do their job?
Well, many ways. One, and we do this pretty well in Broward. Everybody needs to recognize that everybody is doing this work because they want to do this work, and everybody's got a good heart, and everybody is trying their hardest, and everybody needs to treat one another with respect. So all the players at all levels, at the casework level and at the highest administrative bureaucratic levels, everybody needs to understand that we need to work together. We need to communicate freely. We need to be flexible. We need to recognize what the special circumstances of kids in foster care are. And I think we need to start adjusting some of our services to recognize that. We're talking about children a lot here, but the adults, the parents, are just as important. We ideally want to get those parents to a place where they can have their children back with them and that they can care for their children well and their children can be safe. So to do that, we need to get them the behavioral health care services, especially substance abuse treatment, that will enable them to do that. And maybe we need to look at services a little bit differently than we have. We need to adjust the services, substance abuse treatment, for instance, to recognize that there's going to be relapse and recovery, but we don't want to be removing a child every time there's relapse. Can we build in supports maybe and aftercare so that we don't have to remove a child again? Because everybody knows how traumatic that can be. So we need to start looking at things a little bit differently, be more flexible, and be recognizing just how unique the needs of kids in foster care are.
It sounds like you guys are really trying to do great things for children and families.
Well, thank you. Yeah, everybody is, and that's my point. I sort of recognize that everybody wants to do good. We just need to be more flexible about our systems. And the way we do foster care in the state of Florida, community-based care, ChildNet, the community-based care lead agency here, enables us to do that because we can be flexible. We're not stuck in a lot of the bureaucratic things that a big monolithic state agency might be. But we all need to do that.
Okay, so you guys do have the flexibility to meet families where they are and provide the services that they need when they need them.
Absolutely, and we need to keep doing that, and we need to push all our partners to do that.
That's great. Thank you so much for joining us today.
My pleasure. Thanks for having me.